While most that have experienced COVID-19 recover and return to normal health, some patients can experience post-infection symptoms that can last for weeks or even months. We chat to Dr. Emile Reid about the long-term health effects of COVID-19 and, of course, how this can affect the body. We also have Nicole Austin joining us back in the loft, girlfriend, as our health correspondent. It's been so valuable having you in these chats.
It's so great to be here and speaking again to Dr. Emile Reid on something that is so critical for how we move forward from the long-term complications of COVID.
And that's where you come in, Dr. Emile. I mean, after experiencing acute symptoms from COVID-19 and recovering from these symptoms, it has been reported that some individuals experience some post-infection symptoms or even long-term health effects. So why does this happen and how common is it?
We call that phenomena long COVID, or the people that actually suffer from it, COVID long haulers. And what it means is the following. Those people get COVID infection, whether mild or severe, the symptoms complex actually continues outside the frame, which is normally perceived as being normal. And that normally is around about 2 weeks. But in many cases, when it comes to long COVID, can persist for 2 to 3 months. And I've seen cases where it persists for 6 to almost 12 months. I've indicated to you also that the majority of patients admitted to our high care and ICU are indeed men. In this case, however, with long COVID, 78% of patients suffering from long COVID are in fact women.
That's fascinating. And Doctor, I wanted to know from you, age seems to be a big hot topic in COVID-19. Are younger people and children more likely to recover faster with fewer long-term side effects?
You know, Nicole, youngsters, including children, are expected to sometimes even be more asymptomatic, and should they acquire COVID, actually become better much sooner. The majority of long haulers falls in the category of high risk people. And therefore, they, as they get older, also have a higher risk in becoming a long hauler.
What are some of these long-term reported symptoms that people have been experiencing? And do these simply tend to go away with time?
Well, those symptoms frequently encountered when it comes to long COVID includes chronic debilitating fatigue, loss of taste, loss of smell, persistent headaches, dry cough, intermittent shortness of breath, so-called brain fog, where people feel that their concentration is not good, they're not as sharp as they should be, and even depression, difficulty in sleeping, atypical chest pain and joint aches. And usually they tend to go away at some stage, but that timeline varies between different individuals, whether it's 2 months, 6 months, or even a year.
Now, Doctor, you've alluded to some of these serious long-term complications already, but are there some specific severe symptoms that people need to be aware of that can cause serious complications?
That's an absolute fantastic question, Nicole, because usually during the time that we've entered now, where there's a lull in COVID cases, we frequently see a number of medical long-term complications in people who actually already had COVID, which might be extremely serious. And it includes the following. Cardiovascularly, we see people develop heart attacks. We see people developing inflammation of the heart muscle called a myocarditis. When it comes to the lungs, people can develop an entity called lung fibrosis, which means that there is hardening of the lung, which causes severe chronic debilitation after having suffered severe COVID pneumonia. Patients also develop kidney problems, acute chronic renal failure, and also skin conditions, which includes certain rashes or marks, hair loss, and thinning of both the hair and the skin. neurologically wise, smell, taste, concentration, memory issues are probably not so complicated. All of these chronic conditions have a massive impact on people's lives. People have already lost their jobs, lose their income, and they cannot perform their daily tasks.
Well, Doctor, you know, this seems so very scary right now, especially those that are hearing this and have experienced COVID. What should we be doing after experiencing COVID-19 to avoid or recover from any long-term health effects?
Well, as discussed, COVID can infect and affect many different parts of our body. The ongoing pandemic and other events are massive stresses and are clearly adding to our misery that we experience. The following people can probably look at. Number one, if you're exhausted, find out how much sleep you're actually getting and where the problem lies, whether it's in initiating sleep, whether it is maintaining sleep that needs to be addressed. We really don't understand how the symptoms of malaise actually work, but know it's prudent to use extreme caution, especially when running and exercise, which is necessary but not easy to do, especially after COVID. If we are going to exercise, it's important, but we need to take it one step at a time. Eat healthy, avoid alcohol, avoid cigarette smoking. And the other thing I need to address is anxiety is a real issue. And it's important for people to understand that should they need to speak to somebody, a psychologist or a psychiatrist, there's absolutely no shame in that. Lastly, please consult your doctor if you experience trouble breathing, if you experience chest pain, rapid weight loss or weight gain, diarrhea, blood per rectum, heartburn, reflux, and you feel on a daily basis you cannot stay awake.
Yeah, okay, well, we heard you loud and clear, Doc. It seems like the rules stay the same. Nothing's changed.
We need to have a little bit more self-care and self-love, it seems, Doctor. I think we all need to be more self-aware and take care of ourselves.
Absolutely. Thank you so much, Dr. Emile. Goodbye.
Super.
Do you have a survival story? Then we want to hear from you. Share your survival story with us, from surviving a failed parachute to escaping a lion attack. We want to hear your story. IMMUENZA is giving away 5,000 Rand a week for 5 weeks. All you have to do is reply to the IMMUENZA competition post on the Afternoon Express Facebook page or Twitter page and tell us your survival story and what protected you using the hashtag IMMUENZA. Competition closes on the 3rd of March 2021 at midnight. And terms and conditions can be found on afternoonexpress.co.za. Help support your immune system for your next big adventure with IMMUENZA.